around for 50 years. We've seen a lot of peaks and valleys in the market.
Think about areas of investment for healthcare. I often think about cost and access and quality.
Let's go. I'm joined by Annie Case, 2011 national champion for the Stanford women's soccer team, who is now a partner at Kleiner Perkins with previous stints at Uber, Bain. Annie, thank you so much for joining me. We have to skip the small talk. We just have to, because for my Silicon Valley people are into trail running, hiking, beautiful nature around Silicon Valley. It's been advised for me to reach out to you about secret trails, about trail running, hiking. Can you give us a secret if you're in Silicon Valley or in the Bay Area? What are some of the best hiking trails we should check out?
Ooh, that's a good question. Secret trails. I don't think any of them are secret anymore because it's just so accessible from San Francisco. But
Yeah.
one of my favorites, I would say the least secret one, Tennessee Valley. That's like a go-to on the weekend.
Okay.
But there are a bunch of trails, like there's like a core loop on Tennessee Valley that you can do that
Yeah.
everyone does, or just a walk out to the beach and back. But if you are willing to climb, then you do a full climb up. And then there are trails that connect from the top there down to Muir Beach. And
Okay.
there are a bunch of like cutoffs that don't even have names that you can just run trails for hours on the backside of Tennessee Valley.
So Tennessee Valley, you said Muir Beach. Are we talking Marin? Is that
Talking Marin. Oh,
talking
yeah,
Marin.
yeah.
Okay.
Oh, yeah.
Marin talk
we're
right
here
now.
today in the marina in San Francisco.
Okay. Yes,
One of the
we are.
reasons we live in the marina is because it is as close to the Marin trails as we could get without having to leave the city.
Okay,
So for us, it's like always go north for the hiking and biking.
Yeah, absolutely. Are you doing more hiking or biking? Which one of those two?
Lately, hiking. It's easier to do with babies in tow. So
Yeah.
we have two kids, 2 and under.
Congratulations.
So we are mostly doing hiking with babies in a backpack. Harder to do the biking at this moment, but
Yeah.
we'll get back into it.
Understood. Well, wow. Don't say I don't bring the heat on for these episodes, because we got some things to chat about today. Of course, we're going to take it back. The recruit from Merit School in DC at Stanford, 2011, Annie. You have the national championship trophy. Did it run through your mind at that time while you were playing soccer that you would be very interested in digital health and investing in like the futuristic healthcare applications for companies?
I would have had no idea if you'd asked me in 2011 or before that I would be here now in the career that I'm in. I think that's the beauty of how careers unfold, and I'm so grateful to be where I am now. But at the time, no, I was certainly interested in healthcare. Like that's always been true. Healthcare, fitness. I think as athletes, you from a very young age get schooled in like how to take care of your body, how to eat well, how to be ready to perform.
Yeah.
So I was always really interested in health and fitness from that perspective, but certainly would not have known that investing in healthcare technology companies would become a core part of what I did when I grew up.
Yeah, certainly applicable, right? Athletes, we take care of our bodies, amazing. But at that time, what did you think you were going to do? Did you want to play professional soccer after Stanford, or was there a roadmap that you had initially?
For me, I think it was, as a little girl growing up, the U.S. women's national team was the dream, was the goal.
Yes.
I didn't have citizenship in another country, and I was like good enough to play and compete at the highest level in college, play at Stanford. Probably could have played in a pro league, although, wouldn't have been top draft pick, but probably could have like found my way onto a team like some of my friends did. But at that like end of career senior season, thinking about like what path do I take, felt like, at the time, the NWSL was also not at all where it is today.
Right.
Supporting, 10 plus years.
Right.
It's a much more mature place.
Yes.
And there are better options for folks. For me, the idea of, living in someone's basement in New Jersey with a roommate and making $2,000 a year or a month for the 5 months of the season just was like a brutal path. And so ended up deciding I'm going to start my career outside of soccer, and that became a transition point. But no, growing up, I think probably even through most of college, I thought maybe I'd go to law school. I was really interested in healthcare and science, and I was a bio major, but knew I didn't want to go to the medical path. But I just didn't know, the options out there like most people do. And as a college athlete, you don't have time we certainly didn't at Stanford have time to do summer internships. Our summer was 6 weeks long between the end of, school in June and when we had to be back for preseason in August. So I had no idea.
I mean, Stanford has an amazing alumni network, and there's so many people there that give back, and I think you get exposure to a lot of different cool things. But from your perspective, when you did proactive outreach and understanding of the different industries out there that you could see yourself in, what did that process look like for you? Aside from talking to alum, right? Like did you do research? Did you have some internships that, helped mold you? Like in college, I skipped summer workouts. There were some internships that I participated in. What was that for you? What was that proactive, outreach like?
It was tough. Like I think partly I started my career in consulting at Bain & Company.
Yeah.
Great consulting firm, amazing people. I learned a ton. Like I am so grateful for that experience and helped me like launch my career.
Right.
But now looking back, I'm like, why did I do that? I wasn't passionate about consulting. I wasn't, it felt like a great entry point into the workforce because I didn't know what else I wanted to do. But I don't think it was until I was in the workforce, working at Bain, living in San Francisco, talking to people who were, making friends who worked at tech companies, places like Uber. I ended up getting my Uber job through a friend from growing up who worked there. And I don't think it was at Stanford. I think it was after that I figured it out. And I think the goal with this podcast and why I think the work you're doing is so cool is because it's helping people figure that out sooner.
Yeah.
I would have loved for this podcast to have existed when I was in college and say like, wow, what are people in my shoes who are finishing up their sports career, thinking about what's next? Like,
yes.
What are the options available? What should I be exploring that I'm not? Because for me, it was, I guess I'll just go try to get the best job that I can because I'm someone who wants to be successful and I can figure it out and just like throw me in and I'll figure it out. I can do those case interviews to get a consulting job. And then you get there and you're like, what am I doing?
Yeah. And the word successful, like everyone wants to be successful. And then as an athlete, it's just such a general term. If you just think of it through the lens of outside the sport you play, I was like, if I don't hoop, I'll be successful. I'll figure it out. But like, what does that actually mean?
Yeah.
And thank you for gassing the pod. But all I want to be is top of funnel for people to understand, maybe get people interested in learning how to fish in an industry and just see what's out there. I want to pick it up at Uber. You had a variety of roles at Uber. Can you share a little about what you did?
Sure. Yeah, I was there almost 3 years. Had a variety of roles, which I think is one reason to join a fast-growing early stage or even later stage company.
And at that time, it was around 2016, still figuring it out, right?
2016. I mean, it was a big company at that point. A couple thousand employees. It wasn't like early stage startup, the early stage that I now look at in my job.
Yeah.
But it was still on a crazy growth trajectory. And, new businesses were popping up. Like one of the reasons I switched roles was I had been working for our SVP of operations, one of the co-founders, Ryan Graves, as my first role there. I left to move to Amsterdam to help launch new markets for our Uber Eats business because at that point, Uber Eats was actually like the new growth engine in the company. We, following Uber Rides' footsteps of launching really quickly globally, we were already live in most of the cities in the U.S., but we're very early in Europe and Middle East and Africa. And so I moved to our hub over there, which was in Amsterdam, traveled a ton, helped launch the Uber Eats business in a bunch of new countries and cities. And it was like the greatest experience I could have asked for.
Can I give a shout out on this pod really quick?
Sure.
I got to give a shout out to my guy, Steven Chow. Steven Chow started Uber Eats, guy that I know. He is awesome, man.
There you go.
Steven, if you watch this podcast, hit my line back.
No, he's
hit me
amazing.
back. Hit me back, yes.
He was head of product of Uber Eats while I was in Amsterdam. So he was, still based in San Francisco with our product teams, but an incredible ops team based over in Europe, Middle East, Africa region.
Yeah. So if I was watching the Uber documentary on Netflix or HBO or whatever, would we see an Annie Case actor in there? Like
no way.
Annie Case replacement or what?
I was way too late to the party. I mean, I think, shout out to the people who were like really, we called them OGs at Uber, the people who were there first couple years before it was a thing. It was still black cars. I joined when the company was, still growing really quickly, but it was an established company. People had heard of it. People were using it. So, none of that like super early stage first employee kind of like street cred. But I mean, man, the stories you hear even in 2016, it was like, it still felt early and it was still really cool and crazy things happening all the time. Yeah.
And as much as you can share, like, what was the culture like at that time when you were at Uber? Obviously things get tossed in Hollywood and sensationalized, but you went to Amsterdam to launch Uber Eats. I mean, the team is global now, but from your perspective, what was that culture like? An interesting time in the company's, journey.
Yeah, a lot has been written and discussed around the culture of Uber. I think 2017 was a really hard and wild year as it relates to Uber's culture. There was a lot of transition that happened. A lot of, it was part of the news cycle for a really long time, which was really hard as an internal employee. We had company-wide all hands every Tuesday morning and felt like for several weeks, if not months, every Tuesday we'd show up and be like, what disaster are we going to hear about today?
What is going on now? What?
And what was tough for me with that is like, certainly there were, mistakes were made. There were challenges, like don't want to take anything away from people who had a more negative experience there, but I loved it. I had the best experience. I worked with incredible people. I felt like totally respected. I was given so much room to run and growth opportunities. And I feel like it, really launched my career in tech. So I loved the culture. I loved, I worked with amazing people and on all the teams that I was on, but it was definitely a crazy time.
Yeah. What was like the biggest challenge there in terms of expanding what I presume is the Eats reach, right? Getting more users, vendors, people onboarded onto the platform in Amsterdam. You know, let's say like what was the biggest challenge? Because I imagine it's a startup again, right? You got to be scrappy and like talk to the vet. Did you like learn Dutch? Like what like,
No, it was all, thankfully in all of our offices globally, it was like English was spoken. So even when I traveled we launched in Cairo, Egypt while I was there, and the Uber employees there spoke English, thankfully. So you know, you're able to do business and communicate, but the drivers didn't. And so, you know, when we were launching a place like Egypt, the couriers for Uber Eats had to be trained on the app and whatnot. And obviously I couldn't do that. Like we had to have either translators or local people to do that. So there's definitely some kind of local nuances. But in terms of the challenge from doing that through Uber, you know, Uber, well-established, you know, two-sided marketplace, drivers, riders.
Yeah.
The challenge with Uber Eats was it became a three-sided marketplace. It was, you know, the drivers or couriers, the riders, the eaters, and then the stores, the restaurants.
Yeah.
And so it was just an added complexity in terms of like another party to, you know, be at the table and have to make happy. And we didn't have that experience before in working directly with companies.
Yeah.
So that was an interesting. And then, you know, going into new markets, we had a playbook around, you know, where do we need these restaurant partners to come from? Like, what is the right way to launch? And, you know, for me in a city that I had never been to before, it was harder for me to say, these are the local favorites. These are the must-have restaurants in order to be successful. So we had to obviously rely on local GMs and the right people to tell us like what we needed to be successful. So
stay with me here. I want to paint this scenario. Take me back, Cairo, Egypt. There is a top vendor or restaurant that cannot be accessed via vehicle. And so I see this vision of you with your laptop on Camel, going down, you know, trying to find the vendor and then asking them to like fill out and get onboarded onto the platform. How accurate is this to that time?
Oh my gosh. Well, I don't want to take anything away from the local teams because it was not like I was, you know, I went to Cairo and was like on my own, you know, trying to figure it out. We had people infrastructure there. Part of our playbook in launching Uber Eats was to launch in places where Uber, the rides business, already had a presence. And so we could draw on the experience of the team there and get a ton of help along the way. So it was not me in a room by myself launching Cairo, Egypt, obviously.
No camels.
No camels were involved. However, I was able to make it to the Pyramid of Giza while I was there. That was like a nice day trip on my trip out there, which was amazing. But no, you're not wrong. One of the challenges for a market like that was that a lot of restaurants didn't have an address, or, you know, a courier would go to the address and they would say the restaurant was open, whatever, 8 to 5 p.m. It would be 11 a.m. and like they're closed. And you're like, wait, like you said, you're going to be open. Where, you know, where are you? And they're like, nope, just not in today. Yeah. So just, you know, different dynamics than what you'd expect in a San Francisco or New York or LA or some of the markets here. Yeah, absolutely. Well, thanks for sharing a little bit about the Uber experience. Camels. Yeah, camels were involved. Camels. Hashtag camels. If you took one thing away from that, you know, it sounds like it was an incredible time and obviously helped you to what you're doing now, which is now you're a partner at Kleiner Perkins. Wow. I mean, one of the top VC firms in the world, and congratulations on being there and you know, staking your claim amongst the team. So Kleiner Perkins has invested in some incredible companies. I mean, Amazon, Twitter, Google. I mean, if you don't know what those companies are, you live under a rock, buddy. I don't know what to tell you, but I want to start with some rapid fire trivia. Whoa, okay. What was originally Kleiner Perkins' full name? Kleiner Perkins Caulfield Byers. It was Ann Byers, but like that slide. Okay. Yeah, the ampersand. I was going to say, I might get in trouble if I get that wrong. When was the firm founded? In 1972. We celebrated our 50th anniversary last year, which was amazing. Brought back all the partners from previous funds and got together at one of our partners' houses, and it was amazing. Okay. There you go. So 51 years ago. Yeah, that was easy. This is awesome. And before we dive into more specifically, I have a statement. I want you to refute it or agree with it, whatever, you know, you feel. So I think to be a really good VC, there's some level of superficiality you have to act with because you tell 99.9% of people no. But I think VCs are one of the best people in the world at telling you no without actually telling you, actually directly saying no. How do you feel about that statement? Ooh, that's tough. I mean, I would never want to be described as superficial. I think in our jobs, you know, we take the role we play with founders really seriously. We want founders to feel valued and heard, and that, you know, even if we don't end up partnering with them, we've given them useful feedback or pointed them in the right direction or helped them in their journey in some way. We do have to say no a lot. I think for us, our funds are, you know, we have a venture fund, we have a growth fund. We can write a check as small as $2 million in a seed investment up to, you know, 50, 60 plus. And so sometimes it's a no. It's not a no. It's not right now. We look
Right.
at a lot of companies that are earlier even than, they may be raising 500K. It's like way too early for us in terms of like a core investment for our fund. And so we may say, we want to see you launch the product. We want to see, what your early team looks like. To the founder, it sounds like no, right? It's like,
Right.
I need money now and you're telling me you're not going to give it to me.
Sure.
But for us is like, I want to see how you grow. Like
Yeah.
we invest in lines, not dots. I want to get to know you as a founder and then, come back in 6 months, 12 months, 2 years, and let's talk again about what you've accomplished in this time. And
Yeah.
maybe that no turns into a yes. And so I guess I view it more in that way, which is like give them the feedback that will help them get to a place where maybe that no turns into a yes.
Show me what you got. You got to prove something first. And I don't mean that all VCs are superficial, et cetera, but it's so tough for
Some
you.
are, I'm sure.
Yeah.
We try not to be.
Yeah, some are. But it's so tough you say no most of the time. But you don't want to come off as rude or mean or disrespectful. It just is what it is, right? You have your thesis, you have LPs, you have a certain fund requirement, and most importantly, you have your desire of numbers and metrics, like you mentioned, that you want to look at.
But I think it's a founder, but it's part of the process. If you're going the venture funded route, not bootstrapping, is you're going to have a lot of grit. I think athletes make great founders because
Yes.
they have the resilience, they have the grit. It's like you can tell me no 10 times, but I'm going to keep going, and the 11th person might say yes, and I'm going to show up every day and put in the work. And so I actually think that's, in some ways, it's hard. It's obviously hard for founders to hear no a lot, but it tests your conviction in your own idea. Like, am I willing to do this even if a lot of people don't agree with me?
Yeah.
Am I willing to do this even if it's hard and if people say no and if it takes me a year to get to where I want to go and that next step? I think it's part of the process.
Yeah, absolutely. All right, so let me set the stage again here. I got 2 words. Bill Gurley had the presentation of, wow, I don't know if you know what I'm referring to.
I do know what you're referring to, and it is top of my list to watch, but it was just a few days ago. Have not gotten to it yet, but I've heard amazing things. So I'm excited for it.
Bill Gurley gave this amazing presentation on regulation capture.
Yeah.
Bill Gurley is the general partner at Benchmark.
Yeah.
He's been an incredible VC, for the audience who doesn't know, for a very long time, and has invested in I believe, Uber as well as some amazing companies.
Yep.
Yeah. And
Very
so,
high-profile one.
Yeah, very high profile one. I've heard of that one before. And Bill was talking about basically the overarching theme was regulation is the friend of incumbents, and it hurts startup innovation and also results in a net loss for society in many ways. The examples that he used were mainly around telecom and AI. So telecommunications, right, your Comcast, Verizons, and artificial intelligence, obviously OpenAI, Meta, all the things that you're doing around generative AI. But Annie, one of your specializations is digital health in the healthcare industry. In terms of the scope of regulation in healthcare, what are some of the things you've seen so far from your seat at the VC table in terms of how you think about investing in startups and knowing the government's imprint on various healthcare practices and I think operations in the United States?
Yeah, I mean, it is front of mind. I think there are some sectors, of technology that you can invest in and really not have to think too much about regulation, at least not till you're at some larger scale for a consumer business. With healthcare, it is front and center. All day, every day, it is, for a new drug or a new product that requires FDA approval, it is, looking at those milestones to say, like, what'll it take to get approved? Because you can't launch the thing. Your business doesn't exist if you don't go down that pathway, and that can take years and a lot of money. We don't do a ton that has to get FDA approval. On the digital health side, it's more, we're primarily software investors. So it is how can software help improve access and opportunities to access healthcare in this country. But even on the digital health side, you run into regulators in terms of often who's paying the bill, right?
Yeah.
Got Medicare, Medicaid is, the biggest payer in this country. Even commercial plans, you have to say not just will a consumer want this experience, but who will pay for it. And in many cases, that is insurance companies. And so you have to go get approval to be a billable code for them to be able to charge you for care. So it is front of mind in pretty much all the investing we do. We do some where we sell to employers, and so that may fall outside of having to go through insurance companies' payers.
Yeah.
And look more like enterprise software. But a lot of what we do ends up running up against regulation in some way.
Yeah, it's like tricky how you manage that. As an investor, would you like to see less regulation as it pertains to some healthcare practices, or are you guys pretty neutral in terms of healthcare with the U.S. government? And are there some things down the line you're expecting that will influence how you invest in future, healthcare technologies?
We invest a lot as a reaction to or in preparation for regulatory changes because of the impact that they have. So there are new businesses that are created all the time, and COVID was a huge, tailwind for this, where regulations changed around how you could bill for telemedicine. In a lot of cases, there were healthcare experiences that were not covered previously that became covered during COVID because people didn't have access to their doctor in person, and you had to do it via telemedicine. And so new CPT codes were created that allowed doctors to bill for new types of visits that weren't billable before. So that you see a huge shift in dollars from the way things were charged for before to how they may be charged now. And there are new businesses that are created all the time to take advantage of changes in billing codes. And, this thing is now covered that wasn't before. And so there's an opportunity to create a business that would not have been viable before. That's a narrative that we hear a lot in digital health.
Are you connected in DC? You got your people in DC that you have your ear, you have your ear to Washington, and then bring it, what's your...
Yeah, I mean, we do. I think certainly some of the founders of the firm, I think, are pretty involved and have connectivity into DC. I'm actually from DC originally.
That's
so
right. That's right. Shout out Merit School.
But I mean, we try not to overly focus on that because at the end of the day, we're trying to, back incredible entrepreneurs who want to change an industry regardless of what the political or regulatory landscape looks like. But it's something we have to keep in mind for sure.
Yeah. So back to digital health, right? Very fascinating space. And there's a lot of components when we think about digital health. And I don't want to create this whole market map, but from front office operations, from the patient doctor care to back office administrative stuff, just like health stuff, health and wellness. Did you feel like this was a space that you felt comfortable with because of your athletic background, or is it just a genuine interest into it? Because and here's the context of this question. I love sports. Obviously, I play basketball. I like sports tech, but it's not like a burning passion to just explore the different innovations in sports tech. Why was it digital health for you?
Yeah, for me, I would say probably sports played a role. And, some of the investments that I look at are very much in the wellness, performance orientation that I do feel draws more on. I'm how would athletes use or engage with a product like this? And it's helpful. But I think my interest in healthcare, it was bigger than that. I was always science nerd in high school, loved biology, got to Stanford, was a human biology major. Really interested in the science. I worked in a couple labs in college, ruled that out as a career path because it felt a bit antisocial for what I wanted to do, but have always just been interested in advancing science. It felt like an opportunity to improve people's lives, and it's core to who we are, what we do. If you don't have your health, you can't go about your day and enjoy life in other ways. So it's just always felt top of mind for me and something I cared about.
Yeah, absolutely. Obviously, with the intersection of AI and healthcare, it's a fascinating time probably from your seat at the table, seeing how we can help automate or uproot some of the practices that we see in medical care. So what you can share, can you talk about some of the exciting investments that you've made? I mean, let me start here. Modern Health, one of the companies of investment, is fascinating. You're taking this approach from an enterprise perspective of employers adding a feather in their cap or something in their additional arsenal to provide for their employees and benefits wise. Why do you think that this is something that employees will want to readily adopt in terms of using this mental health platform to help with their 9 to 5?
Yeah. I mean, mental health has been, wow, what a topic over the last 5 years. I think, COVID accelerated a lot of people's adoption of these products because people were suffering. There were people, employees, kids at schools. It was a really hard time for a lot of people. And not to say it created these problems, but a lot of folks were forced to say, wow, if our employees are at home still trying to do their jobs, but struggling, they're, depressed, anxious, just have too much stress on their plates. How can we provide for them in an environment where we can't see them face to face, they're not coming in the office every day. So, a digital solution like a Modern Health played a really, really important role during that period. But our investment predated that. We led the Series A in Modern Health in the beginning of 2019. It was one of the first investments that I worked on when I joined Kleiner.
Wow.
And that was, pre-COVID. And what we saw there was this trend towards mental health becoming more of a topic. For a while it was stigmatized, taboo. People would engage with a therapist but wouldn't tell their friends about it, wouldn't talk about it.
Yeah.
And we saw more and more people wanted to talk about it. It came to more of the forefront in terms of, national conversation. And so we saw an opportunity to say, we think that this will become a thing that employers are willing and able to pay for on behalf of their employees. We think it'll become a core part of the medical benefit that employers provide.
Yeah.
And so, we're fortunate to ride the tailwinds through COVID, but, the trends that we saw predated that.
And when we talk about therapy and the advance of technology, what's your take on using a human therapist versus some of the AI-generated emotional support things that we see? I would like to think that human support, there's nothing you can do to replace that human emotional support to help you with therapy. But in the digital health space, I mean, what is off limit? Like, what's your take there?
I mean, that's certainly the hot topic in the space right now. I think some of the capabilities of AI now to dramatically expand access and lower costs to some of these, treatments is really exciting. Modern health is when it is a therapy visit, it is one-on-one with you and a person. They do some group visits as well called circles so that you can, it can be one to many, but it's still a real provider, a licensed therapist or social worker or clinician in some way. And, that's been an important thing for employers to say, like, we're giving our employees access to the real deal. Like these are people who know their stuff, they're licensed, they're registered and so forth. Going forward, I'm tracking very closely a lot of companies that are trying to build ways to expand access, because not everyone works at a company that pays for a benefit like this. So we still have a massive access problem to mental health services in this country. There's a shortage of providers. Like, the number of providers we have today cannot serve all of the people who need access to that sort of help. And so, something's got to give. I think we need to find ways to get access to more people, and technology is a great way of doing that. And so I'm really encouraged and excited by what AI can do to expand access to mental health care in this country. But I think you also have to be really careful, right? You can't just have, let it loose, have a bot be the person, be tech that is driving your interaction exclusively. I think that'll lead to some pretty hard results. And you've already seen some issues with that around some of the AI companions and what can happen when somebody who's become dependent on that AI companion loses access to that person. That can be really hard. And so I think we have to do it. We have to do it carefully, in a way that can harness the benefits and expand access, but without being reckless.
Yeah, sure, absolutely. And then I'll touch on one more on sort of the portfolio side of things. I mean, this word scribe, right? Documenting the patient and clinician conversation, super important, as there's many nuances. There's like many things that, like, if I was in a pickup game a couple months ago and I had a head-to-head contact, scarred on the head, and I went to the hospital, and this is not a pity party. I'm just like, let's fast forward. Like, I'm talking to the doctor, he's asking me how I feel, etc. There's some language maybe that I'm saying that is important to document and has the potential to influence what treatment he prescribes.
Yep.
And I say all that because you've invested in a company called Ambient, which helps sort of this AI scribe process, to my understanding. How do you feel about using AI once again to capture nuances of health and how someone's feeling?
Yeah, I mean, that's a company I'm super excited about. I think the technology is incredible. And the problem that they're solving, like, back up, and the best way to document a visit between a patient and a doctor was, in many cases, a decade ago, to have a third person sitting in that room, like, taking notes on what the doctor's saying, what the patient's saying. And, in many cases that was the doctor themselves. So instead of, looking at you, the patient, they're looking down at their now computer or tablet, but previously, notepad, and writing things down. And I think it takes away from the patient and provider experience. And so finding a way to not require a third human to literally sit in the room with you just to take notes, and to enable the doctor to not have to be looking down at their notebook instead of interacting with the patient, frees up time for the doctor and the patient to have the best interaction that they can, while still capturing the important information that will go into the EHR, into the system, that will then, be how that doctor gets paid for the visit, how you get the correct diagnosis, and so forth. So it's just using technology to do, like, that is a perfect insertion point for technology to say, we don't need to have a physical person sitting there.
You're getting rid of that physical manual labor and hopefully doing it better. Maybe.
And also, helping. We have a huge provider burnout problem in this country, obviously exacerbated by COVID. We had, nurses quitting hospitals in droves, doctors saying that they're really unhappy because it's just they're overworked. Like, we don't have enough of them, and they feel like they're taking on too much. They're not able to spend as much time with patients as they want. It's causing students now no longer wanting to go to med school at the same rates that they used to, because it's become such a hard path. And so companies like Ambience, we believe, will help make doctors' lives easier, because they don't have to spend 5 hours a day at the end of their day managing documentation for all their visits. That can be done automatically using technology.
Yeah. It's so cool to talk about, because, I want to paint this picture of the different advancements in health tech and the different spaces where we're seeing, these new technologies uproot. So from the lens of an athlete, right? Like, if I'm someone, who's interested in digital health, and obviously, aside from maybe one of your answers that I'll anticipate would be like, go to the portfolio job openings and on our website and see,
Great plug for Kleiner Perkins portfolio.
see who's hiring. Like, to work at a digital health company, like, that doesn't require med school, does it? Or what are, like, medical requirements to work for a digital health company versus, being a nurse, right?
A super important question. I think something that keeps brilliant people away from, some of these companies or industries where they're like, what would I be able to contribute to a digital, for me, like I didn't go to medical school. What will I be able to do for a healthcare company?
Right.
And I think it's important to help people understand that at any type of company, any early stage technology company, there are different functions that may be either super related to healthcare. Like in a healthcare company, you will most likely have a chief medical officer and a clinical team, depending on what type of service you're providing. But yeah, those people are MDs. They have been to medical school. They are the ones who provide that the clinical oversight and set care pathways and so forth. But beyond that, there's all the same functions that you'd see at another company, an Uber or a Stripe or any high growth technology company. And so you could work on the operations team. You could be an engineer.
Right. Okay.
We don't require engineers to have MDs.
Right. Right.
Like you need people who are selling the product, building the product, and all those functions are the same, whether it's in healthcare or fintech or enterprise software and so forth.
Yeah. Yeah.
There's a job for everyone out there.
There's a job for you. There's a job for you, right? You know what I mean? Like there's opportunity out there. Okay. Yeah. And I think that's reassuring for you to say because, at first when I saw digital health, I was like, okay, well do I got to get an MD and I need to know JavaScript, like all these things this is like cluster combination of skill sets.
Yeah. We try to get, during COVID, we saw an influx of people who were trained, engineers trained at companies completely outside healthcare, no experience in healthcare. Many of them, calling us. I had a ton of conversations with great engineers that I'd known from previous companies who said like, I've never been in healthcare before, but I want to be in healthcare. Like that feels, I'm drawn to that mission. I don't have that experience, but like, how do I get involved? And you're like, what we need is high quality, incredible engineers to want to join the cause and work at healthcare companies. So that is very welcomed. You do not need a background in healthcare to have an incredible impact in a healthcare company.
Yeah, that's incredible. And for someone, and once again, like looking, like if I were an athlete interested in getting into digital health, but I don't know where to start looking.
My advice,
like,
healthcare aside, like for anyone who is like, I think I want to be in technology and I don't know what my skill set would be a fit for. Hardest part's getting started.
Yes.
You really just need to get your foot in the door. I have seen so many people who've started as a recruiter or a customer support associate who've then pivoted, leverage their experience, proven their worth and their capabilities once they get to a company that then move into product management or operations or decide they actually want to be an engineer, go back to school to become an engineer. Like just getting into a company and learning about the various functions, seeing that growth trajectory of a company, I think can be the best training ground. And so, don't get too fixated on title or comp or just get started, get a job that you can. You'll learn a ton about that industry. And if you want a career in tech, you'll find your path over time.
I got an idea for you.
Yeah.
I got an idea. It's not really for you, but it's for you to pass along, and hopefully the telephone goes successfully.
Okay.
Let's say Ambience, like what stage are they? Are they past Series A, B? Like how many employees do they have?
They have raised a Series A.
Okay.
Yeah, still small.
When Ambience grows a little more, I got a message I want to pass along to them. They should make new employees be a nurse for a week as part of their training program, so they see the physical side of it and understand why their technology is helping, get rid of that physical labor.
Yeah, I mean,
like throw them into the fire.
It's a great idea.
Get them in the ER.
Most successful tech companies have found a way to do this, right? Which is and I think, product managers is a core part of their job, customer support associates, like you need to understand the interaction and the impact that your company is having in a real way in order to build the best products, have the best experience. At Uber, we did this all the time. Like when I was in Amsterdam, I did deliveries for Uber Eats. In Amsterdam, it's on bikes. It's a small city. I got on a bike. I went to a restaurant. I'd pick up the food. I'd drop it off at someone's house.
Yeah.
The next one. I got to experience what that driver experience was like. I think the same's true for healthcare. Obviously it gets tricky. You don't want people who aren't licensed to.
No, you don't. Maybe not. Don't throw them in the ER yet. Don't throw them in the ER yet. But give them a little sprinkle.
But shadowing folks or listening to patient interactions, like calls between doctor or patient. Like there are definitely ways in every company where you can understand the consumer experience or like that core interaction of the company in a really unique way. And I think that's super important for people to do.
Yeah,
whether the company is like Uber or an Ambience or any other type of company.
Amazing. And zooming out here for a bit, in the next 5 years, where would you like to see your career go and your impact on the digital health industry?
Yeah. Oh, big question.
Yeah.
I mean, my career, I am really grateful. I feel like every day I am grateful to work where I do and have the opportunities that I do. I know how lucky I am to be able to say that. I know for a lot of people, a job feels like just a job and something you have to do. And I'm really, really lucky that I get so much energy from my job. So, for me, career-wise, would be like, I want to keep doing what I'm doing. I want to, grow in my responsibilities, grow in my role, get better at what I do every day. But I really love it. And so, hopefully in 5 years, I'm still doing this work and working with incredible founders, building my portfolio and yeah, that's the dream.
Amazing. All right. This has been another amazing episode of Athletes and Assets with Annie Case. Annie, partner at Kleiner Perkins, former national champion at Stanford University. Annie, thank you so much. That was a blast.
Thanks for having me. It was amazing.
And that's a wrap.